Good afternoon, everyone. Thank you for joining us for the College of Education's Colloquium series. I'm Greg Bernard, class of 2004 and Director of Alumni Relations. To provide a little background, this series, which features dynamic educators and administrators making an impact in their respective fields, is intended to establish online forums that engage in thought-provoking and critical dialogue with our alumni, faculty, community leaders, and elected officials. The College of Education endeavors to empower leaders, educators, and parents to address the challenging times while advocating for the principles of social justice in our educational systems and within society as a whole. Before we begin, I wanted to go over a few guidelines. In order to avoid any potential audio-visual issues or interruptions to the program, we ask that all participants be muted upon entry, and we also ask that you remain muted throughout the conversation, both audio and video. We will now give everyone a few moments to ensure that both your audio and video are turned off before we proceed. Thank you. Secondly, if you're viewing from your personal computer or laptop, in order to optimize your viewing experience of the program, we recommend you change your view to active view as opposed to gallery view, as this will highlight the individual who is speaking at that time. This should be located at the upper right-hand corner of your screen. Click Speaker View, then select Active Speaker View. If you're viewing from a phone or tablet, your default view should be set to Active Speaker View, which contains 4 participant windows. And lastly, in order to ask any questions, we ask that you use the chat feature to communicate, which will be monitored throughout the program and questions shared during the Q&A segment. Without further ado, I would like to introduce to you the Dean of the College of Education, Dr. Stephen Hegedus.
Thank you, Greg. Welcome, everybody. It's my great pleasure to welcome you all here today to our virtual colloquium series. This is our second in our series this year, and it is the first time that we have done this virtually. I'm very excited to see so many of you here today, and so many of our alums that we are continuing to reach out to and to engage you with some really very timely and very pertinent topics that intersect with our education programs and our education initiatives that are going on in the College of Education. So I'm very proud of the faculty and our students that have been participating in this series of events. Today, we are going to be hearing from our leaders of our Autism Center, our Center for Excellence in Autism Spectrum Disorder, and continuing the theme of having a critical dialogue around these themes of the intersection between race and autism. We started our series about a month ago with some of our local superintendents and leaders who are also graduates of the College of Ed and Southern Connecticut State University. And it was a really engaging conversation. We're discussing the challenges that our school leaders have at this time and really looking at it from a leadership perspective. So today we continue along that theme, and I look forward to hearing from you with your questions and your comments, which I'm going to help field to our speakers today. So thank you for being here, and thank you for continuing to support our series. I'm now going to hand it off to Dr. Cynthia McDaniels, who is our moderator today. She is a professor in the Department of Educational Leadership and Policy Studies. She's also the chairperson of that department. Thank you, Cynthia.
Thank you very much, Dean Hegedus, and thank all of you for being here today. I'd like to start off with introducing you to our presenters. We have two very distinguished scholars. The first is Dr. Fred Volkmar. Fred, hello Fred, give us a wave. Do we see you? Okay, Fred is the Irving Harris Professor of Child Psychiatry, Pediatrics, and Psychology at the Yale Child Study Center, Yale University School of Medicine, and our own Dorothy Goodwin Family Chair of Special Education here at Southern Connecticut State University. Great to have you. He is an international authority on Asperger's disorder and autism, and was the primary author of the DSM-4/5 Autism and Pervasive Developmental Disorders section. He has authored several hundred scientific papers and has co-edited numerous books, including Asperger's Syndrome, Healthcare for Children on the Autism Spectrum, A Guide to Medical, Nutritional, and Behavioral Issues, and the recently released third edition of the Handbook of Autism and Pervasive Developmental Disorders. He serves as associate editor of the Journal of Autism, the Journal of Child Psychology and Psychiatry, and the American Journal of Psychiatry. He also serves as co-chairperson of the Autism MR Committee of the American Academy of Child and Adolescent Psychiatry. Since 2007, he served as editor of the Journal of Autism and more recently of the Encyclopedia of Autism. Quite an impressive resume. We also have Dr. Kari Sassu. Dr. Sassu is a director of strategic initiatives for the Center of Excellence on Autism Spectrum Disorders, and she's also a professor in the Counseling and School Psychology Department here at Southern. She's worked with individuals with ASD in public schools and private settings, conducting assessments, developing individual plans, and providing supports that capitalize on individual strengths. She is a licensed psychologist, a nationally certified school psychologist, and holds certification as both a school psychologist and a school administrator in the state of Connecticut. Her professional experience includes service as a public school psychology practitioner, coordinating the implementation of system-wide positive behavioral supports across school districts, and conducting neuropsychological evaluations of children and young adults within a practice of clinical psychologist. I've worked with both of these very distinguished individuals for several years, and I learned so much from them. So without any further ado, I'd like to begin the conversation that we're going to have about autism. And as Dean Hegedus said, the intersection of autism, race, and other inequalities. So we'll begin with the first question, which will be to Kari. Kari, could you briefly tell us about the center?
Absolutely. Thank you, Cynthia, for those very kind introductions of both Fred and myself. Our center was established in 2010 in response to what our evidence needs throughout the state of Connecticut for improved practices for working with individuals on the spectrum. The mission of the center is really to enhance outcomes for individuals on the autism spectrum by way of building capacity within various domains or various settings, be they public schools or institutions of higher education or vocational settings or just larger communities. We are a multidisciplinary team. We have special educators, behavior analysts, speech language pathologists, assistive technology specialists. Fred is a psychiatrist, I'm a psychologist. Some of us wear multiple hats. I'm also a parent of a child on the spectrum. And through all of our professional training and experiences, we inform what we do through a multi-pronged approach. And that is through training, research, and outreach.
All right, thank you. Fred, I'd like to ask you a question. A lot of us don't know what autism really is. We hear it, we think we do. So would you start off by briefly defining what autism is? And we hear a lot about the autism spectrum. What is that?
Sure.
Could you explain that?
Happy to give it a shot. And if we can have the next slide. Up we come. So what is autism? So, whoops, we got the wrong slide. There we go. All right, stay right there. So what is autism? Autism is a disorder in which essentially children from infancy, probably from the moment of birth and probably before, of course, lack the usual interest in other people. I don't know why the mission slide, yes, if we could just stay with this slide, it would be very helpful. If you lack that usual interest in people, if you don't play the social game, you have horrible, horrible problems. It has multiple impacts on a range of early developing functions and very profound and persistent effects on learning. If you lack that social frame, all kinds of bad things happen. You don't have the motivation for language and communication development. You don't learn from just watching your parents, what's called joint attention. Incidental learning, the things that typically developing kids just pick up on just by watching. Things like prosody, the sort of musical aspect of your speech, you don't get it. You don't learn, for example, the salience of individual words. You tend to process language as you hear it in chunks. So you might ask for things like want a cookie means want a cookie, want a cookie, want a... It's that whole phrase that has the meaning, not the individual words. 9-month-olds are speaking with English prosody, and they are hearing segmented language. They're hearing want a cookie as several different words. All this happens without sending the baby to school. So this is all stuff that happens very early in life, and then it has profound effects, including organizational effects. If you're a good social player from very early in life, you get very good at organizing. You can multitask, what psychologists like to call executive function. And that means that you can keep your overall overarching goal in mind, and then you can have little sub-processes. You can tune in and out as you're working towards that goal. And if you're a person with autism, you get easily stuck, you get easily derailed. The other problem is you have a major problem with self-regulation. You like things the same. You don't like variation and change. This makes for trouble. You have troubles with social attention and focusing. So there's a whole host of things that kick in from very early in life that really color the child's ability to learn from a typical school environment. The happy news is we do believe, and I think with good evidence, that earlier detection... Sorry, is somebody interrupting?
Looks like we lost Fred for a minute there. Let's see if he's coming back.
I am online.
Oh,
Okay.
can you hear us? Okay.
I can hear you.
Okay.
Okay.
Okay. All right. You're back. Thank you.
Okay.
Continue, please. Okay.
So I was just saying that autism leads to major problems in organization, behavioral regulation, a sort of profound insistence on sameness in the environment. The trouble is, if you don't have that social frame, you go to plan B, and plan B is usually try to make sense out of the world by contingency. A happens, B happens, A happens, B happens. So you get interested in things like light switches, iconic images, things that have kind of static, unchanging aspects. And all this makes for real trouble by the time you get to school. The happy news, as I was just about to say when I think I faded out, is that earlier detection seems to be making a profound difference in terms of outcome. We now have more and more students coming to college with autism spectrum disorder. They want to go to school. We can have a whole discussion about transitions in college, and that's a whole package. Last year, we had 40 students at Southern who self-identified as having autism spectrum disorder. And that's kind of typical around the country. The biggest school program that I know is University of Texas, Dallas, where they have over 500 students. But this is happening around the country. These are kids who are challenging the system because they need a different kind of supports than many of our college support programs are interested or sort of able to work on. We can talk about that if anybody wants to ask a question about it. But with new and evidence-based treatments, there's no question children are doing better. And finally, let me just say that we've also become aware, partly through the studies of genetics of autism. Autism is brain-based, it's strongly genetic, that there's a broader spectrum than just classical autism. So the recent name change has been to calling autism autism spectrum disorder, ASD it sometimes is termed. We could again have a whole discussion about that. It's a welcome change, and it acknowledges the fact that there's probably a broader spectrum that reflects the complicated underlying genetics of the condition.
All right, well, thank you for that very informative overview, Fred. And as you said, we will be asking questions throughout the next hour and a half. So Kari, talk to us about why we should be interested in the world of autism. Obviously, as educators, we want to provide quality education for all of our students, but tell us a little bit about the world of autism and why we should be interested and know more about it.
Yeah, well, the good news, I guess, is that I presume everyone here is already interested in the world of autism because you're here.
That's true.
So,
That's right.
So thank you for that interest and for being here. But just speaking about it more broadly, and we do have a slide with some statistics on it. If we think about the first statistic that's listed on that slide, if I'm remembering correctly, is that approximately 1% of the world's population has an autism spectrum disorder. And more than 3.5 million Americans have an autism spectrum disorder. It is the fastest growing developmental disability according to the CDC, and the proliferation of this diagnosis is following a very steep trajectory, or has followed a very steep trajectory. Fred, this is another one of those points that you could have a whole discussion on the proliferation of the diagnosis itself, but suffice it to say that if you look at that little graphic in the bottom, the numbers are clearly following a steep trajectory, and the most recent estimation from the CDC was that about 1 in 54 children in the US has an autism spectrum disorder, when in, I think the earliest year on that picture is 2004, it was 1 in 166. So, those prevalence estimates have increased from anywhere ranging from 6 to 15%, I think, over the last couple of decades. Sadly, another concerning statistic set of statistics, I guess, are the statistics surrounding young people with autism and their rates of employment. Young people with autism have the lowest employment rate across disabilities. So their counterparts, when they exit high school and are in their mid-20s, over 90% of adults with other disabilities such as emotional disturbance, speech impairments, learning disabilities, held gainful employment by the time they were in their early to mid 20s. So over 90% of individuals, their counterparts with other disabilities. 74% of young individuals in their 20s with intellectual disabilities have held some form of gainful employment by their mid-20s, whereas only about 58% of young people with autism have been gainfully employed by that same point in their lives. There are actually probably more dire and striking statistics if we look at employment across the lifespan for individuals with autism. In addition to higher rates of unemployment, individuals with autism who are employed are largely underemployed, meaning that they're not engaged in work that makes full use of their skills and abilities. And so if they have work, they're far more likely to have menial jobs than competitive ones, even if they have average or above average cognitive abilities. So I would say that's a long answer to your question, but these are realities that are not just realities for the families of individuals with autism, but for our society as a whole. Anything that, it relates to high levels of employment for a particular group, or when we're talking about the proliferation of a diagnosis and the associated costs, be they financial or otherwise, when they're this considerable, those, in my opinion, should be societal concerns.
When looking at the statistics and the numbers, you can see that we all should be interested because it impacts all strata of society. And Fred, Since we're talking about inequalities and social justice, I'd like you to speak about returning to the diagnosis of autism. Are there inherent biases? I think I can answer part of that because in preparation for this session, I've done a lot of research, and the literature is replete with articles and information on the inequalities in screening, the inequalities in diagnosis, the inequalities in getting treatment, and so forth. So could you speak about biases in the screening during the diagnostic period? And yeah, just primarily starting off with the diagnosis.
Sure.
Because many of the descriptors that you identified earlier would not necessarily be seen as autism for the untrained person or someone that just has, you know, a little knowledge of autism. So,
Okay,
yeah.
let's see if we could have the next slide. And here we go. So what do the data tell us? And as you've just heard, there's actually a certain body of data on this. And we put up, I believe, or will be putting up on the website, a little tiny reference list of some of the more relevant articles, and also a chapter on cultural issues, because this gets us into a sort of complicated area, which is related to both the minority students, cultural issues, interestingly also gender issues, and also poverty. So it's a convoluted bit of business. We do know that there seems to be underdiagnosis of autism in minority populations, and this seems to reflect several factors. And I'm going to talk about Hollywood in just a second, believe it or not. In the first place, seems to be a lack of awareness on the part of parents and teachers in schools where there's a tremendous amount of socioeconomic stress, poverty, large minority populations. People just don't think about autism, neither the parents nor the teachers. People are so busy just coping that they kind of don't take a step back and say, geez, I wonder if this child has autism. There's a general lack of screening. We have some good, well, we have some okay, not good, but okay screening instruments for both younger children and for that matter, school-aged children. There are some that were developed specifically for school-aged children. We have someone for very young children. Interestingly enough, parental concern about the child's development, even when parents don't know about autism, at 1 year of age, if the parents are worried, that's actually one of the most predictive signs of autism. One of the troubles with the screeners is they're not always very selective. People don't always use them. When they use them, they act on them. We have a complicated system in this country. If your pediatrician or your family doctor is told by you or himself or herself notices a worry or concern, we can ask for an evaluation by a state agency called in Connecticut, Birth to 3, Child Find, other names around different states. And they will come out and they will do an assessment, and they will tell you, they may be worried about the risk for autism because of multiple problems in multiple areas, social development, language, motor imitation, other kinds of things. And they can institute services before the child is 3 when there is a passover to the school district and the mandate under federal law for schools to start providing services. The problems at every single stage of that process, people aren't picked up. Minority students tend to be picked up the least, and we'll talk about that more in a second. Then the referrals don't get made in the right way. Parents don't follow up with the referral agencies don't come, or they come and do their assessment. They don't communicate back to the pediatrician. The pediatrician doesn't follow up to see, okay, you got the assessment, you got a recommendation, did you get services? All those steps. There was a study from California that showed a trickle-down effect, so that fewer than 0.5% of all parents actually who got an early worry about autism actually got into services. So that's just a general worry. Then we have the issues around minority populations, and that reference list I mentioned to you has some of the data on this, which is pretty good. And it would say that there's a very strong awareness of autism in upper socioeconomic status populations, people who are better educated, college educated. And of course, that means there's a bit of a bias against an awareness of autism in populations where there's less parental education, where teachers may be less well-trained, where there's a lot of stress anyway, inner city schools. And back to my Hollywood story, one of my many hats is I'm the editor, as you heard, of the Journal of Autism. Some years ago, I got a paper from Los Angeles looking at rates of autism across the city of Los Angeles. Now, it's interesting, you would think, and these people were interested in the rates of autism. Their particular thing was they were looking for potential environmental causes of autism, and they had some funding to do this. But you may not guess, or maybe you will, where are the highest rates of autism in Los Angeles? What part of the city would have the highest rates? Just take a second to think about that. Well, the answer is Beverly Hills. The wealthiest areas have a much higher rate of autism than the other parts of Los Angeles. Where are the lowest rates of autism? Again, take a second to think. Watts, East LA, places where there's poverty, where teachers haven't had a lot of the training, where the parents don't even know about autism. They're just busy coping with horrible conditions and other things, and the kids sort of fall through the cracks. And of course, the people were very convinced there was something in the water. In point of fact, the water is the same throughout Los Angeles. What they're picking up on is something else, and it's something very profound and important. The people in Beverly Hills, if anything, have a bias towards getting a diagnosis of autism. It's something they know about from the TV, from the internet, from movies like Rain Man, from the ads for Autism Speaks. It's also a more hopeful diagnosis, for example, than intellectual disability. We expect children with intellectual disability, or what used to be called mental retardation, to improve over time. But some of the children with autism make tremendous gains, some going on to be quote unquote perfectly normal. Well, and I wouldn't say perfectly normal, they're certainly, they do much better, and they have a very good outcome. And that's clearly happened over time. So the people in Beverly Hills, they're on board for this. Also, autism is a bit of a golden ticket. Autism gets you the most services. If you have an autism label, oh, great, you get speech, you get OT, you get PT, maybe you have an age, you have all this stuff that usually kicks in if a school district thinks the child has autism. They'll have an IEP, they'll have a lot of services, there's a plan, people are monitoring. That's all good news. You're in a very poor section, people don't think of it anyway. And if you do, you may not get nearly the same kind of degree of intensive services or extensive services. So all those factors just within one city can make for just dramatic differences in terms of rates. There's no question that there's no difference in autism across Los Angeles. That's crazy. What there is are major things that bias our detection of cases. This also then gets us into other issues we can get into if we have time. There's some cultural issues in autism, and one of the things we put up on the website is a chapter on cultural issues. As you think about it, we see autism from everywhere. I've seen kids with autism from every continent on Earth except Antarctica. And they look remarkably the same. How it's thought of and how it's treated, very different, but it looks the same. One of the issues with the cultural stuff in autism, there may be problems with some of the instruments we use to assess potential autism diagnoses, and there's some good data that shows this may well be true. Things like eye contact, for example, can vary tremendously from culture to culture. Some of the Eastern cultures, eye contact is a bit more complicated. You're not supposed to make eye contact except in special situations. Even within America, there's some suggestion that there may be some minority difference, for example, with Hispanic families responding to questionnaires about autism. So there's a packet of stuff around that. And then finally, there also are gender issues. We've become increasingly aware that there's probably a bias against diagnosis of autism or the broader autism spectrum in girls and women. That partly reflects the fact that girls and young women may have actually different manifestations of the syndrome. It may be quote unquote less severe. They may be better at camouflaging that. It's a whole complicated package of stuff. But again, one of the things we go back to, the instruments, and there are between, I'm gonna say 30 to 40 instruments. If anyone's interested, I can send you a chapter that will tell you. 30 or 40 instruments on screening and diagnosis. All of them to some degree are based on sort of quote unquote typical, meaning normative, usually white, middle class to upper socioeconomic status populations, usually boys of school age with mild to borderline intellectual disability. That's how they got developed. And so it's not surprising, and interestingly, we discovered from some of the large studies on screening, for example, in Norway, where they used screening for 40,000 kids to look for autism, and it decided in the end to stop screening because it didn't work so well. They relied instead on pediatrician judgment. The problem was that there were gender bias in items. The girls and boys were responding, the reports were different from parents for girls and boys on these screening items. So all of this stuff goes in there. And then finally, we've got the problem of overdiagnosis. As I mentioned, in affluent areas, Beverly Hills, people want this label. So this is a problem because they may not, quote unquote, deserve the label, but they want the label. And of course, as we know, there's educational versus medical labels, and it's a complicated business to get into, and we may have a chance to talk about it. But it's a problem with sort of, and sometimes even when the diagnosis could be justified, because for the school's purposes, you may have to select one label. Well, often people will push, let's get the autism label out there. Don't go for intellectual disability, don't go for ADD, let's go for the autism spectrum. And so again, that's a push, and it's a problem because it does lead to the sort of misimpression that autism may be biased in favor of high socioeconomic families. This was actually true. The first man who reported on autism said that 10 of his 11 cases back in 1943, the parents were remarkably successful people. That's because he was the only, at that point, child psychiatrist in the country, only person who had an interest in the syndrome that he was going to describe as autism. And so the people that got to him were much better educated and successful. They were academics or researchers. So it's got a very interesting, complicated history, but there's no question that we probably pretty profoundly underdiagnose autism in minority students, especially those living in poverty.
Okay, thank you for all of that information. I was looking at a study, I was trying to put my finger on it, where there was a comparison of white physicians and Black physicians and how they diagnosed autism. And it's a very interesting study. I'll find it, I'm sure, before this session is over. But it was kind of worrying that there were two different approaches to how autism is diagnosed by different physicians. So let's go on. Kari, describe the level of awareness and the skills needed to accurately identify autism within the schools. That's a special, Dean Hegedus?
Yeah, I was just wondering, sorry to interrupt you, but we've been receiving quite a lot of really interesting questions. Maybe this is a time we could pull, I feel like I'm the reporter out in the field, right? I've got my microphone here actually. So, you know, I'm reporting back in. We have some great questions. Can we take a pause for the speakers for a moment?
Well, yes, absolutely. So you're receiving the questions. Could you start us off?
Here. The first, and I think it's to the points that we've heard so far. So the first question we received was, is there more identification because there's more awareness in the general population, and then more testing? I think it's a good question. I don't know who wants to field that one.
Kari, you want to, or you want me to?
You can go ahead. I think you were talking about overdiagnosis anyway. I know that this is a multifactorial equation and complex.
So the interesting thing is way back when I got into this field back in 1980, and I was just out of my training, and I had moved to Yale to work with somebody who's had an interest in autism, and there were a handful of places around the country that had an interest in autism. And at that point we said, well, maybe 1 in 2,000 children. But the trouble was those were the most severe cases. And at that point in time, this was before Public Law 94-142 and many of the other things that we now know about autism, those most severe cases, they basically got shipped off to state institutions. They didn't stay in communities, they didn't stay in their families, they got off. And then the kids who were maybe on the autism spectrum, but who could kind of barely make it. They were weird, but they could pass through, or they could have their little niche in the school or whatever. As we've gotten much more aware of the broader spectrum, these numbers have increased. Part of that is underdiagnosis in the first place. The question of whether there's a true increase or not is a complicated one. The best kinds of studies, and there's only 2 studies in the world that have looked at this, one in France and one in Denmark, are studies looking at exactly the same place over time and taking snapshot after snapshot after snapshot after snapshot to see are the rates changing using the same system, and the answer is no. But the problem also is we change the systems periodically. So we update various approaches. The current approach, actually the DSM-5 approach, is probably more conservative than the old DSM-4 approach, and the pendulum sort of swings back and forth. The screeners vary in terms of being more liberal, less liberal. So it's a whole very interesting and complicated bit of business. But as we've gotten to be more aware of the broader spectrum of autism and the complexity of the genetics of the condition. So you might have a family where one kid has autism, there's another kid who's a really good speller or a really good mathematician or a really good whatever. And again, certain areas where this could be very adaptive, and that sort of makes sense in the evolutionary sense of there has to be a reason these genes have continued to circulate around. For some combinations of these genes, there must be an adaptive function. And for those kids who have a very specific narrow focus, who can really do well, who can be the standout, winners of the National Spelling Bee, who can do other kinds of things and go off and do amazing things, can go out to MIT or go off to Palo Alto and work in Silicon Valley. For them, it may have a certain advantage to have some of these genes. And for other kids who get a bit different package, they may have the full-blown syndrome. So it's gotten to be a very interesting and convoluted, complicated issue. There's no question that we're seeing it more. The question is we're seeing it more because we're more aware of it? The answer probably is yes. We don't totally know. As I say, the 2 studies that have looked at the same area over time geographically have not seen major changes, but it's only 2 studies. And it's in Europe, as I say, Denmark and France. And so we really would like to have better epidemiological data. One of the other challenges, I have to say, sadly, much of the epidemiological research often focuses on the label for school purposes of special needs. And if there's a bias towards getting a diagnosis of autism to get services, there's going to be a bias in terms of overestimating rates of autism based on that school label. And that also seems to be a very complicated sort of issue, because that's not uncommonly the way some of these schools are done. I had a paper come into the Journal of Autism some years ago that in the end I rejected. And it was a very large national study reporting high rates of autism. And if you looked at the study at the end of the day, the real thing was nationally representative sample, thousands of kids, blah, blah, blah. They report high rates of autism. Well, how do they find the autism? They asked the mother one question. Has anybody in the healthcare profession ever said the word autism to you? That was it. No assessment of the child, not even looking at school records. It was just, yeah. And then they got high rates because people talk about autism, they're more aware of it. So in the end, that paper got rejected for the reasons you can think. But there's no question we're seeing more of it. The really interesting question is, was it just there all along? It certainly is very consistent with this notion of a broader spectrum and a range of diagnoses. And again, it also speaks to educational versus medical labels. The medical labels sometimes can be overly stringent, especially for research purposes. The educational labels don't necessarily have to be exactly in parallel and lockstep. And so, and you can argue the merits of the 2, but it's 2 somewhat different systems.
Thank you, Dr. Volkmar. It's very complex, and awareness is from Kari, multifaceted thing. So I'm going to combine the next 2 because I think they sort of link together, and then we can, I'll pass the mic back. So the first question, I think these questions sort of like part A and part B. What is the best thing schools can do to ensure that students with ASD are set up for post-secondary success during the transition process? And I think it's worth noting that the center's work has expanded in this area on the Southern's campus by working with our undergrad population who are self-identified. I think that's, maybe you can talk to that as well. But best things schools can do prior to that is the first part. And then we have a special ed teacher as well who's asking, what about post 21? And what happens then? And what about mentors and programs and job training in that area, and parental education, particularly in low poverty areas, or again, to the point you mentioned about Los Angeles, particular areas that don't even acknowledge or understand for cultural reasons. So it's sort of what can schools do, and what can we do at universities, and what can we do post 21? I know you've both been doing a lot of work in this area.
Do you want me to take that one? Okay, I'll start it off. So again, I think there are a lot of questions sort of coupled together there, but the first being, and you know, this probably sounds very simplistic, but the first being really starting early. We talk about a transition process in education, and we talk about, you know, initiating transition. In the state of Connecticut, it's just the law has now been changed to require that schools start examining or beginning the transition process at 14. In my mind, and I think in a lot of people's minds who work with individuals on the spectrum or any group of children with special needs, 14 is too late. We ought to be thinking about transition from the time that child enters the school, because this is a lifelong process. It is a planning, is an evolution of a being and a life, and there are ongoing changes that we need to be mindful of. So I think what we ought to do again, like I said, this is going to sound very simplistic, but we ought to start identifying not just what are the challenges that present within each child, but what are the strengths that present within that child. And in addition to that, what are the interests that that child is demonstrating, so that we can capitalize on both the strengths and the interests. To a great extent, that's what we all do, right? So why doesn't it make sense that we start doing that with children on the spectrum from a very early age? I think that bodes well for their success. That the ways by which we do that vary greatly within schools, and, you know, even within districts, certainly, you know, from district to district and across the nation and in other countries. But I think we could be doing a much better job of identifying children's strengths and identifying their interests from an early on, and then beginning to systematically program with those things in mind from early stages, as opposed to trying to get square pegs to fit in our round holes of established education. So that's the first, I guess, the answer to the first part of that question for me. I don't know if you want to add something to that part, Fred, before we go on to the second part of that question.
So I think you have to realize a couple things. One is kids with autism always have trouble with transitions. Transitions are hard for them. That's just a blanket rule. So anything you can do to help modulate the newness of the transition. So showing if the child is moving from one school to another, having the child go to the new school, walk through the school, meet the teachers, see the school with kids in it, see the school without kids in it, make up a picture book with pictures of the school. This is your math teacher. When things are going to change dramatically, so when you're moving, for example, from one classroom all day to multiple classrooms, how do you get from point A to point B? And here's your map, and here's, remember, this is how we go, and this is how I ask help from Mrs. So-and-so. Then thinking about, obviously, as well, some of the other nuts and bolts that we talk about often when we talk about educational supports. Where is the child seated in the classroom? Does the child need an extra minute or two to make the transition before all the crap hits the fan? You'll forgive my saying, when the students are out in the hallways, give the child with autism spectrum a minute's head start. There's a lot of things you can do that will actually help the adaptability. This also, of course, happens at the next step, which is the high school to college or transitional program issue, which is going to anticipating the next discussion. But it's the same set of issues, which is all of a sudden a new set of challenges. There's new expectations for self-sufficiency and organization that may be very difficult for the child with ASD.
Okay, Stephen, did you have one more question, or shall we move on?
I think if there's anything briefly to the point about post 21 as well, and supports there, and you're both, or 18 to 21 during university. and then post 21 when sort of funding drops. And are there any thoughts there on what we need to do or what needs to change? And then I pass the mic back to you, Dr. McDaniels. Kari, did you want to add to anything there?
Sure. Yeah, no, I think, you know, to Fred's point, I think as explicit as we can be at any age, as explicit as we can be in terms of our teaching and transitioning kids, whether it's from, you know, elementary to middle to high, or high to post-secondary, or employment, the explicitness with which we kind of teach them and acclimate them in pursuit of what are their interests and capitalizing on the strengths, that probably is most likely to yield the greatest return on our investment. And the greatest degree of success for them. So I do think that, well, commonly in our field, we talk about kids on the spectrum falling off a series of cliffs, and transitions are cliffs for these kids. It is a big wave that hits them in a very dramatic way each time they face a transition. So for those of us who are invested in assisting with those transitions, I think we engage in what are known to be best practices in teaching individuals on the spectrum, and they're explicit practices. They're showing, they're not just telling, they're modeling, they're showing, and then they're supporting them as they do. Like, to put it in very simple kind of teaching strategy terms, right? That's the most we can, that's sort of the most we can do, I think, in terms of assisting in those transitions, wherever they happen.
Thank you. I'm going to hand it back to you, Dr. McDaniels. There are some other points around culture. I know our theme is linked to race and culture, and I know you're going to be talking about that probably very soon, if not now. So yeah, back to you.
Yeah, thank you very much, Dean. Kari, I do want to ask the question. We've touched around it in this last question and answer period, but I would like to just ask it to make sure we, tie up any loose ends. Describe the level of awareness and the skills needed to accurately identify autism within the schools. I'm still not quite clear as to what the role of the school is, who is doing it, and so forth, and the level of awareness. How is that measured? What's been the best practices? So if you could just take a few minutes and address that, that would be helpful.
Yeah, no, thank you. I think that's a great place to start, is with awareness, because it doesn't necessarily require that everyone in the school have a high degree of skill in terms of helping in the identification of autism. But having a certain level of awareness is sort of the foundational piece, the fundamentally important piece, right, to the that leads to the identification of autism within schools. So from that standpoint of awareness, one thing that is fundamentally important is recognizing and appreciating the common characteristics of autism. So if everyone in the school setting could just sort of know very basically the common challenges for individuals with autism include some, the things that Fred mentioned earlier: difficulties with communication, restrictive and repetitive behaviors or repetitive behaviors, and problems with communication. If people could know those three things in terms of their basic awareness, that would be great, because we would all have kind of our antenna up for that. It's also critically important, I think, that school-based personnel are aware of the spectrum that Fred mentioned earlier too. It's called an autism spectrum disorder because the people who have this diagnosis are a heterogeneous group themselves. And while those characteristics, regarding communication and restricted behavior and social interactions are common among individuals with autism, the differences in how autism presents in people varies greatly, right? There are those individuals, Fred mentioned earlier, individuals with intellectual disabilities. There are individuals who are nonverbal. There are, by contrast, individuals who are highly verbal, and people who are highly intelligent. There are differences in the ways that boys with autism present and girls with autism present. And so being aware of that is important. So all that is to say that awareness of the common characteristics and the variability of presentation I think are what really underlie school-based professionals' ability to then conduct effective assessments that will lead to the accurate identification of children with autism in schools. In terms of the specific skills, and I think that's what you were asking, Cynthia, the specific skills or training required in order for that accurate identification to occur within a school setting. Within a school setting, there are various professionals representing different disciplines, specialists, special educators, school psychologists, speech language pathologists, behavior analysts, all those people that populate our center team. Each of those specialists has specific training in various assessment and observation tools. And they engage in a school in a multidisciplinary evaluation of the child's abilities across multiple domains. So we take a multidisciplinary team-based approach to evaluation in a school setting. And what I would say is then, I'm sort of kind of scaffolding this, I guess, but what I would say is important that each of these professionals who have specialized training and skill in assessment, in addition to kind of having that skill in administering those various assessments specific to their respective disciplines, is that they're able to view the results of those assessments through the lens of autism. So I'll share a story about, well, not really a story, just sort of an anecdote. My oldest son is on the autism spectrum, and an early assessment sort of through that child find piece, but it was school-based personnel administering it. An early assessment resulted in no significant findings. And that was because the selected tools didn't explore things like pragmatic language, so his ability to kind of communicate with others, didn't examine social interactions. And an assessment for those with autism or someone suspected potentially of having autism should involve tools that evaluate not just various cognitive abilities, but also involve observations of behavior and social interaction and engagement with others. And also, again, as Fred mentioned, an assessment should seek to understand the child's developmental history. So, professionals need to understand kind of what are the components, the key components of a good autism assessment conducted by a multidisciplinary team within the schools, but also understand the limitations of the tests that they use. And in terms of how sensitive those instruments might be in terms of their identity to kind of their ability rather to identify subtle differences as well.
Okay, and I wonder about the role of parents and classroom teachers before the specialists get involved. That level of awareness should be high, and there should be some type of announcements or training or some type of information that can help parents and classroom teachers help in the initial, if not diagnosis, but the initial identification that these types of behaviors are taking place. Is that correct?
Absolutely. I mean, as we conduct, and again, another thing that Fred mentioned earlier was the note that, when parents have raised concerns about their child's development, that's a big cue, right? That's a big cue to us that we should be listening to. Parents have spent the most time with their children. They have observed subtleties in their behavior, in their interactions, in their communication that we won't necessarily see in our educational setting or in perhaps a private setting. So we need to bring parents into the fold to the greatest extent possible, because a comprehensive, a responsible, a thoughtful assessment is going to necessarily involve the parent. We're going to collect data from across settings, from multiple sources. That is truly getting a full picture of how a child presents. So absolutely, parents should be not only invited into the conversation, but they should be at the forefront of those conversations to share all that they have in the experiences of their children themselves.
Okay, thank you. I see Dean Hegedus.
I've got some more questions. I think people are also interested in this underdiagnosis around specific minority groups. Is it something that is there any factors that lead to underdiagnosis or misdiagnosis as it relates to minority students? And I think we were thinking of talking about that as well.
Okay. Should we address that now, or we'll just continue and?
I think so, because I think
Okay,
that
all right.
it's come up, so maybe it's
Let's
timely.
get-
Sure.
Okay, okay,
Let me,
Fred.
let me say a little bit, and Kari may want to add. It's an interesting discussion, and she and I are doing a nice job of covering all the bases. I think one of the things to keep in mind is there probably are many factors. One is lack of information on the part of parents and teachers in schools that especially are facing many challenges. That usually is poverty. It's usually inner city. It's places where, you know, parents are so busy coping, they don't worry about the child. They don't necessarily pay it as much attention and be as worried as perhaps other parents might be. Teachers themselves are having some of the same issues. There's a lack of a systematic approach to screening and sort of thinking about autism. It would be somewhat unusual in a typical middle class population for a child to get to a diagnosis of autism in school. Usually it's made around 3 to 4. That's the usual time when a diagnosis is made. I've seen children, the youngest I've ever seen that I was worried about was 6 months. By 3 years, we can be really certain about whether or not a child has autism or not. But the more able kids, the more cognitively able kids sometimes slip through the cracks. That's a well-known phenomenon. And you will sometimes see kids who are talking your ear off. And so they will slip through. So there's a whole issue of kind of parental and teacher education information and lack of resources to sort of think about good screening. As I mentioned, the screening instruments, even when people use them, may not work so well. And there's some suggestion of bias both in Black and Hispanic populations, people of color, and there's other suggestions around the world that there may be problems in third world countries as we sort of think about our Western ideas of what is typical in terms of social development, and we sort of try to apply that in the developing countries. So it's probably this whole constellation of things, and the birth, as I mentioned, the sort of the gap between the educators and the medical professionals, and as we were hearing earlier, also the question of education of the medical professionals. Do they even think about autism in a child who comes in from a poor family, where there's a long list of things that they need to talk about: lead screening, safety, blah, blah, blah. And they may not even get to the autism questions. So that it's a whole package that sort of conspires against overlooking autism in minority populations, especially early on, which is the time we think we could probably be the most effective.
Do you want me to add to add to that? And as it relates to schools, I would just say, you know, and Fred, I think what's become or come through very clearly here is, you know, there is a harsh reality that race, socioeconomic status, and gender all factor into what I refer to as this, you know, multifactorial complex equation that determines whether and when a child might be diagnosed with autism, and subsequently what services or what level of care that child might receive. And, you know, when we think about that from the standpoint of available resources to those within certain, you know, economic data, for example, we pretty easily see that there are going to be those who, you know, to Fred presented rather the contrast between Watts and Hollywood. There are going to be those who are very easily able to access certain resources and leverage supports within their communities, right? Because there are just social connections that they have, or they have financial means perhaps, whereas others are going to have far fewer resources available to them and be far less likely to leverage similar supports through the channels that, you know, we've mentioned. So it's about access. And as it relates to school settings, you know, as Fred noted, and I think this is worth underscoring, you know, to have schools be the first kind of gate through which a family or a child with autism passes and have that be the first identifying piece. It's usually the difference between those in higher socioeconomic strata or coming from certain communities is that, you know, if I guess what I'm trying to say is that while there are laws and regulations that were put in place to increase the likelihood that children with special needs are identified, and they will be through their public schools, those with resources are more likely to be able to have their children identified earlier on. When children are in the public schools, there's a great degree of variability, not just in terms of you know, the resources available to them within their community, but even within their school setting, and that comes in terms of human resources and intervention, selection, and other such issues. So access is a big element, I think, or a big factor in that equation.
Thanks. I'm going to hand it back. I know we only have 10 minutes, and I know they wanted to talk a little bit as well about future centers. I'm going to hand it back to.
Oh, okay. I've lost all track of time. Thank you very much, Dean Hegedus. I'm thinking we're just getting started. The conversation is just incredible. The information. All right. Well, I have a series of questions, but some of them have been answered. But let me just ask them in case our presenters want to say something else. So what I was going to ask you, Fred, was the social economic levels in terms of diagnosis. And you have covered that. Is there anything else you want to say about the biases in terms of SCS status, or you've covered it very well?
Well, I think we've talked about all sides of it, and it could come from the physician or the healthcare provider. It could come from teachers. It could come from within the family. It could come from within the school. And of course, as we know, this pervades our culture, sadly. And so there's many potential places for it to rear its ugly head. And sadly, it does. And often when you see children who've gone undiagnosed and you say to yourself, how in the world could this have happened? You then trace it back and you discover one or more of these factors in play, as Kari was alluding to.
Okay. Kari, just doubling back one more time, the difference between medical diagnosis and educational classifications, and how do they impact the determination of the school services that the school will provide?
Sure. So, you know, Fred spoke a little bit earlier about the medical diagnosis and how one comes to have a medical diagnosis or an outside diagnosis of autism spectrum disorder, which is typically given by a physician or a psychologist, and, you know, results from that a meeting or a consultation with a patient or a client, and in which the professional kind of examines the criteria and the manifestation of symptomatology, let's say, of the person in front of them, according to the Diagnostic and Statistical Manual. So they perform a clinical assessment and make a determination as to whether the individual meets those certain diagnostic criteria. The educational eligibility for special education services is determined by a set of criteria associated with the Individuals with Disabilities Education Act, so IDEA. Autism is one of 13 eligibility categories, and the ways by which school-based team determines that eligibility is through that multidisciplinary team assessment process that I described earlier, and an associated checklist of criteria. So those are the basic differences, but I think the actually more important and interesting points are that a child doesn't necessarily need a medical diagnosis of autism in order to be qualified to receive special education services within the school setting under that eligibility category of autism. The school-based team can conduct that evaluation, and it allows for that determination to be made. And it really is about the impact of one's disability on their ability to access their education and to make progress. The sort of the converse of that is just because an individual has a medical diagnosis of autism doesn't automatically confer special education services. So within the schools, it must be determined that a child meets those eligibility criteria, and that the disability has an impact on the child's learning and school performance. It also bears noting that not everyone with a disability requires special education services, right? So it's important that the team, the educational team, considers that too, and that is the educational impact on one's disability. Yes, the educational impact of one's disability, I should say.
Okay, Stephen, more questions?
And I do want to, as we approach the end, Dr. McDaniels, so we've got a few minutes left, just want to be sure that the team has time to talk about the future work of the center as well. So there's a couple of questions, and then maybe we'll go to that. So one of our participants said, teachers sometimes say, well, I think the father is on the spectrum. So is there any studies that determine there are links, genetic links between parents and children? And the other one, which is very timely, how might the present pandemic impact autism diagnosis and access to services? So two very different questions, but I think.
So
really
let me take the first, and Kari can take the second, if that's okay. So the answer to the first is yes. There's a clear, strongly genetic component of autism. If you assume autism occurs in more or less 1 in 100 people, if you have a sibling with autism, your chance of autism is about 1 in 10. We used to underestimate that for complicated reasons I don't want to get into, but it's very interesting. And you can have fathers who themselves are somewhat on the spectrum. It is usually fathers. Now, again, there's this problem of bias and potential women against getting a diagnosis, but there's also maybe a real issue of when you look at people with typical IQ levels, the male to female ratio with classical autism, Asperger's, is on the order of 50-to-1 male to female. So yes is the short answer to what could be a very interesting longer question. I'll turn it over to Kari.
And the second question was about the impact of the pandemic on diagnosis. Okay, so
and access as well to services.
Oh, and access to services. Yeah, so it's a great question, and one, unfortunately, I don't have a very satisfying answer for. But certainly, I think there's a fair amount of negative impact of the pandemic on many things that are happening in our lives right now, but certainly on diagnosis. Being able to be in the presence of someone to perform a really thoughtful and well-informed assessment is compromised by our social distancing requirements at the time. So seeing someone active in what we would refer to as their natural environment, if we're talking about kids in school, nothing about kids' environments right now in schools is natural. It is very contrived. And in some ways that's actually been beneficial for some folks, and in other ways it's been more challenging. But so there definitely has been a negative impact in terms of the restrictions placed on us in being able to access one another, but also administer certain assessments and use our clinical skill and judgment when observing individuals. So yes, I don't think that an assessment virtually comes near the quality of conducting an assessment across settings and in person. Access to services is the same, right? Some folks are perfectly content to access services virtually, and it is very reasonable to them. Other folks, and this is individuals on the spectrum and neurotypical folks as well. Other people find it very difficult. I would say as a practitioner, as a clinician, there's a lot that's lost in this virtual space that we are not able to gain as we would were we physically present in the same room with someone. So being able to observe subtleties. The thing that's most concerning to me about the inability for folks to folks on the spectrum to access services right now is that, you know, I think it's about 1 in 4 young people with autism is determined to be really socially isolated. And I imagine that that's far greater right now by, you know, given the circumstances. It certainly seems to be far greater for all of us. So I imagine the statistics surrounding that, were we to have them, would be far more dire. Not a happy note to end on. So let's talk about some things that the center is doing to improve outcomes for folks.
Yes, please carry on. Tell us about the center. We need to know more about it and the work that you're doing there.
Actually, I think we have a slide. If we can do that, can we get our slide up? Next one. There we go. Whoops, back. Maybe Kari, you take the left half and I'll take the right. Whoops, you muted, Kari?
Sorry about that. Yeah, so we have a number of training initiatives ongoing for teachers or really educational professionals right now. One of which is the development of a series of videos that will speak to, it's about 20 short professional development training videos designed for school-based personnel. And they're going to kind of cover a multitude of topics, I guess, from an introduction to autism all the way to specific strategies and supports, approaches to collaboration with families, and so that we're scheduled to record those in January, and those will be outcoming. We have also, you know, in sort of the wake of the school closures last spring, we also put together some initiatives that would allow teachers or school-based personnel to kind of engage with us in a consultative basis. We also have had some parent engagement, or what we called sort of friendly forums as well. And we have college support series, teacher support series. There's a video, kind of a group of lectures that Fred and some other folks from our center have put together to support university faculty, college students, and their peers in navigating the college arena. The program for students at Southern with autism, this is a TEACH program. I'm gonna let Fred speak to that because he can speak much more in depth about that. But we also are excited, this is not specific to the center, but it is the College of Education to have a new master's program that we're able to offer in applied behavioral analysis through the Department of Special Education.
It was great. And we're also doing some outreach. We've had a program for some years about training babysitters. It's called the SIT program. It trains parents, grandparents, babysitters about how do you approach a child with autism if you're going to be a first-time babysitter and you hear the child has autism. And we're about to do a rollout of a statewide training program for this through the Department of Education. We're also very actively doing first responder training in autism that's now required by the state. You heard about our friendly forums. We're having a series of Friday morning science talks. We just had one this morning on using puppets in autism. It was fascinating. We're having a conference in April about transition and transition planning. We have a number of new grant initiatives and research. One of the things we're hoping to do is at Southern replicate a program that's been ongoing at Division Teach, which is a statewide program through the University of North Carolina, Chapel Hill, supporting first-year students at college to help them kind of make it through the first semester, which is the critical time for them. One of the first things, for example, you do is you sit down with the students and you fill up their schedule. No more white space. They know exactly what's happening when, and the problem is when students get to college, they're confronted with this thing that has a little program here, it has a class there, it has a class there, and they just squander the rest of the time. They have no idea that they need to structure themselves around learning. So there's a lot going on. And if you visit our website, and I'm sure we'll have the website address on, you can come and see all the various things going on. There's always new stuff happening, and we're happy to recommend it. And I'm going to turn it back to the Dean because I think the Dean may want to end with the UN.
Okay.
Yeah, well, thank you. Shall I wrap it up, Dr. McDaniels, now? I'm just looking at time. And
Yes, in the interest of time, I just want to, before you wrap it up, I just want to thank Fred and Kari for this amazing presentation, and also the Dean for sponsoring this and for helping out with fielding the questions, and the Alumni Affairs, Greg and Doreen. Thank you for all of your support. So I now will officially turn it over to the Dean to share.
Thank you. Thank you, Dr. McDaniels. And yeah, this has been a really fascinating dialogue, and there have been some great questions. The questions are still pouring in. So what we'll do is we'll reach out with some answers as well after the event is officially ended. And we'll also be contacting you with some with the link to the resources that we have provided. They are on they're on our website. There was a link. If Doreen or Emma could pop that back up into the chat box so people have it, that would be great. And I think we'd just like to end, and then I'll talk about the next event in our series very briefly. You know, this was a couple of years ago. Oh, we've lost the slide, but a couple of years ago, we were invited, Dr. Volkmar, Dr. Sassu, myself, and Dr. Ruth Erin, who was the original founding director, and also Dr. Haynes from the Education and Leadership Department, and one of our grad students as well, to the United Nations to talk to the ambassadors from the sub-Saharan continent and the countries there. One of the major issues that we just very brief, there's so many things around this, it's a very complex area, but with the sub-Saharan countries that were represented in this room, there's a lot attached to it. There's a lot of stigma attached, and a lack of conversation and discussion. So the cultural factors really impact how people talk about or not talk about autism, or not diagnose. That's really challenging. And so that is a major racial issue there, and we're going to try and continue to work with colleagues in those countries. So this is a global issue and a very complex issue. And it was great to be at the United Nations, and looking, I'm trying to hold something up there. But I want to thank our speakers. I want to thank the great work the center does, and the work it does with our students as well. We will be continuing our colloquium series. We're so happy that so many people are joining and sending positive feedback. So we wish to continue the series throughout the year. Our next one will be at the end, towards the end of January. And it will be on how do we prepare for inequities in our school systems. So what are we doing in our various programs? And that will be led by Dr. Jessica Powell, who is a member of faculty here in our Department of Curriculum and Learning. We also have a graduate, a student in our doctoral program, Jonathan Berriman, who is also a teacher in New Haven Public Schools. And we also have one of our graduates who graduated in special ed, Clarissa Rodriguez, who will be joining us. So we'll have a panel of 3, and we'll be talking about the preparation both in pre-service and in service, and in addressing inequities in our school systems at the moment. So we hope you can join us for that. We will be sending out an invite soon. And I would just once again thank our speakers today. Thank both Dr. Kari Sassu, Dr. Fred Volkmar. It's always fascinating to work with you and listen to you and learn. Every time I'm with you, I learn something. So thank you very much. And thank you to Dr. McDaniels for moderating this, and for letting me be the roaming mic on the road in my home office, fielding the questions. It's very fun. Thank you, everyone who's joined us today. It wouldn't be anything without having that interaction. I know it's very different to being in person, but I hope that you've enjoyed it today, and if we don't interact, have a great holiday season. My very best to you all. Take care.
Thank you.